Greetings and welcome to Conversations with AARP Virgin Islands. I'm Troy Deshabere Schuster, State Director of AARP in this territory, and it's a great pleasure for me to be with you on this day. We have a very special guest with us today, and that is Commissioner Kimberley Causey-Gomez, the Commissioner of the Department of Human Services of the Virgin Islands. Good day, Commissioner. How are you?
Hi, Troy. Thanks for having me. I am doing great this morning or this afternoon or this evening. I don't know what day it is, but yeah, I'm doing great. Thanks for asking.
Wonderful, wonderful. Thank you, and thank you for taking the time out of your busy day to be with us to talk a little bit about the Department of Human Services and all of the great things that you do here. And so tell us a little bit about the department. As a
Yeah.
commissioner, what do you do? And just like an overview of some of the services that the department offers.
Thanks, Troy. So, Human Services is the second largest department, and I feel like we're so interwoven into the community that we touch almost everybody. We're little people for our Head Start program, our early childhood. We do child care and regulatory services. So we touch our little people and their families. And then we do the spectrum all the way to the homes for the aged and our senior services. And so in between that, we serve people with disabilities through our vocational rehab program. We have our eligibility programs, which is SNAP and Medicaid, our children and family services, intervention, intake and emergency services. So we do quite the gamut. And so that service part, we're here to serve our community when they need it the most. And we're usually trying to be the light or the hope to help you through a very difficult time. And so that's what Human Services is here for.
And would we be accurate in saying that the Department of Human Services is one of the largest in the territory?
Definitely. We're second to education, and as far as the number of people working and the number of people we serve. So we serve a little over 31,000 members for Medicaid and a little, between 15 and 20,000 for SNAP at any given time. And so that's a lot of people. That's almost a third of our population that we are providing some type of service to.
Yes, and we didn't really plan on discussing this, but now that you brought up Medicaid, how is that Medicaid expansion going? I know there was some issue with some part of the Affordable Care Act as it pertains to the territories expiring at some point. I know I'm putting you on the spot a bit about this, but
Good. We're always fighting because we feel that we are not treated equally like other states. And so we're always fighting for that. We got 100% FMAP or that federally Medicaid, that equality aspect. We're down to 89.2% as far as the reimbursement part of it. We're doing okay. And I think that a lot of people do not take Medicaid. That's an opportunity for a lot of people that we're missing. So I think that we can serve more people in our community through Medicaid. So if they're not having insurance, then I think that they should look and see if they're eligible for that service, because we do a lot of off-island travel and cancer services and really help those that are really in need medically.
yes, it's such an important service. I mean, healthcare, especially health insurance, with the costs of medical care these days, it's so important. And we're so pleased that through the Affordable Care Act, we were able to expand Medicaid here in the territory and make sure that many, many more people are covered now under some type of insurance, whether it's insurance provided by an employer or Medicare or Medicaid.
And then we have the CHIP program, which is the Children's Health Insurance Program, which is right under Medicaid as well. So most of our children are eligible for that. And so if you're a parent and you may not be eligible for Medicaid, but your child might be eligible for CHIP. So I think that making sure that you have that health insurance, and just in case something happens, you just never know. It's good to have that coverage.
I've never heard of CHIP. In all the years that I even owned and operated a pharmacy and dealt with Medicaid, I've never heard of CHIP. Is that something that's relatively new, or has that been around for a while?
I think it's been around for a minute, but it's called the Children's Health Insurance Program. So it's called CHIP. And so, I mean, that's a good part of it. And our children should be covered. And so especially this day and time, and I think that that's an important part of it.
Right. And one big issue for us here in the Virgin Islands is housing of all
Yeah.
levels. And the United Nations estimates that the population of Virgin Islanders over the age of 50 will increase from 41.4% of the population to somewhere around 44.1, so from 41 to 44% by 2030. The percentage of Virgin Islanders over 60 will increase from 27.6% to 32.9%, according to uh, global statistics. As Virgin Islanders age, the likelihood that they will require long-term supports and services will also increase. So what is the vision of the VI Department of Human Services for providing long-term care services and support systems for dependent adults and elders in this community?
So for human services, my vision, and I think it's the governor's vision as well, as for the Healthy Housing Initiative and looking at all spectrums of housing. And so I think if we're looking at it on a holistic perspective, a community perspective, it's not just about making sure that our seniors are taken care of, but the whole perspective. And so when you look at it like that, we have 2 homes for the aged, Queen Louise Home for the aged, as well as Herbert Brick Home for the aged. And in 2017, both of those homes were damaged. They're not skilled nursing facilities. They're not certified Medicaid, Medicare certified facilities right now. So the vision is to have a CMS certified state-of-the-art facility in each island, or each district, I should say, because we're not going to have one in St. John right now. But the vision is to expand the services to a 60 or an 80 bed facility in each island. And so what that does, it increases the capacity of us as we get older and increase the ability for us to be reimbursed for some of the services. So currently, if you're a resident at either facility, you're paying on a sliding fee scale. So if you're able to pay the monthly fee, then you do. If you're not, then we're taking care of that. And so that means that we're always at a deficit if we're not. It's the revenue and cost, right? Mm-hmm. And that balance. So the vision is really make sure that we have a healthy, safe environment for all aspects of the population as we age.
Right. You know, that's something that's very important. Well, there's so many things that are so very important, but going back to one particular thing, most people here in the Virgin Islands don't really realize that our homes for the aged are homes for the aged, and they're not skilled nursing facilities. Correct. Certified by CMS. And therefore, as you said, these homes for the aged cannot be reimbursed by CMS.
Correct.
So a huge burden falls on the government to provide for the residents there, the patients, if you will, and to maintain the whole facility. So it's extremely important for us to have CMS certified skilled nursing facilities here in the territory.
And that's ultimately our goal. So, you know, if you're looking at the perspective of long-term, so you have the short-term planning. Right now, the damages from the 2017 hurricane and the FEMA and the reimbursement aspect of it, and trying to make renovations and do construction when you have a very vulnerable population in both. How do you do that? Where do they go when you're doing that construction? So if you've ever had construction on your house, Troy, and you try to live in it at the same time, it's very dusty. It's very, so you have to be careful with that. So we're making sure, but it also costs a lot of money to renovate. And so we don't have that all in our budget for capital projects. And so that shared cost is what we're looking at in order for us to build those 2 facilities. So a little bit of FEMA money, some hazard MIT money, because it'll be a safe room. So they won't have to, evacuate the building in the event of a disaster. So you want to make sure it's a safe, solid structure, so they're safe during any kind of disaster. And then looking at community development block grant funding as well as disaster recovery funding. So if we blended some of that, that's what we're aiming for. So we put our application in for the CDBG for both facilities. And so we might have to downsize it a little bit because I went big. I was like, I'm going to go big and try to get as much as I can because I think it's important. Therapeutic rooms for our seniors as well. And potentially, when you go into the hospital and let's just say you went in and now you're safe to go to be discharged.
Right.
But you're not safe enough to go home quite yet because you still need a little care. So there might be a way that we are able to do some of that in our homes for the aged as well. So you might have a transition way. So we're exploring all the possibilities, and I think that that's an important part of it.
Yeah, and I like what he said about thinking big, because we do need to think big. The older population, as we just established, will continue to increase, right? We're going to have more and more older people. People are living longer.
Correct.
I mean, before I was born, for instance, which wasn't that long ago, um, a
Not
lot
too
of people, not too long ago, a lot of people didn't live much beyond the age of 70. A lot of people died in their 50s and 60s, and
long.
now we have people living into their 80s and 90s. And actually, the insurance actuarials, all of those charts that they develop and all of that, are going now up to the age of 120. So they're now figuring out that some children, people who are children now, will
Yes.
live to the age of 120.
It's interesting because, we have the Centenarian Project, or I can't remember always the name of it, but we have a list of those that are over 100 years old. And we had someone that just turned 100, Miss Carty, I believe, just turned 104 or 105. And so we have several that are 103, 104. And so then you go, what is the longevity? How are you living that long? What is it that you're doing to ensure that you're healthy up to the very last part? And so we want to make sure that in the end, that you have a safe and healthy environment. But I don't always think it should be on the government. And I think it should be a nice blend of community, public, private partnerships if we're able to do that. So I think if we can look at it from the perspective of are you able to take care of your loved one, or do you need help?
Right.
If you need help, then I think we need to be here, but it shouldn't always fall on the government of the Virgin Islands to take care of your loved ones. I don't know where that came into effect, because I just remember always taking care of our grandparents. Like my grandmother lived with us after she had a stroke, and she lived in our dining room. We cleaned out our dining room, and that was her room. And she lived with us for a long time until we couldn't take care of her anymore.
Right, right, right. Yeah, well, these days, talking about people not taking care of their loved ones, we know of so many people who have been abandoned in our hospitals, right?
Correct. Yes.
They come in for acute care, they're suffering with some kind of acute condition, and then they're abandoned there. So tell us a little bit about how that's been happening and what you all are doing to try to help with that situation of people being abandoned in the hospital.
It's an unfortunate situation, because you may not have or be able to afford taking care of your loved one, especially if they have extreme medical or special needs. But abandoning them is not necessarily the issue. But some people feel like that's a last resort, that they just can't do it anymore. Maybe they've done it for a long time. And so when someone goes into an acute situation and they're left in the hospital and there's no safe discharge, they stay there until there's a safe discharge. That is costing, that's uncompensated care, sometimes can cost up to $1,800 a day, depending upon what part of the hospital it is. So if we can find a safe discharge, that can go anywhere from $200 to $400 a day. So the cost for us is less if we can find a safe environment. So we've done a couple of off-island facilities, because right now we're at capacity for both Queen Louise and Herbert Gregg, until we're able to expand and do some renovations.
And with all of the various hospital-borne diseases like C. difficile and methicillin-resistant Staphylococcus aureus, MRSA, it's so dangerous to have older people just residing in a hospital when they're not in need of acute care, right? When they're just there for a year, 2 years, and they're being exposed to all of these pathogens, they can contract one of these pathogens and become gravely ill.
And it's not fun. I mean, as you're aging, you want to be around some people that are having a good time. And so some of the other things we provide is the senior centers. And we have one in St. John that's just been renovated. So we're going to get ready to reopen that. We have a Richmond Center in St. Croix, and we have Strive in St. Thomas. And so before COVID, oh my gosh, they have such a great time. We pick them up, we bring them, they have their lunch, they're with their friends. And what better way to spend your day than with your friends, playing bingo and having a great time. So I think that that part of COVID, and we talked a little bit about that before the show, Troy, is the COVID experience and what does that look like now for our seniors. And that's a really hard place for them to be. It's very lonely. It's very depressing, especially if you don't have any family. So if you don't
Right.
have any family coming to look for you, I'm glad that my staff, Human Services, loves what they do. Those that are working in pretty much in every division, but specifically for senior citizens, because that's our topic today, our staff is amazing and they love their job. So they're going in and taking good care of those that don't have the families to do so.
That's wonderful. Yeah. And even from the perspective of AARP, I mean, I always congratulate and commend the staff at Human Services because it's a heart work, right? It's a work of the heart. When you're caring for other people, when you're doing good for other people's life in a very real, tangible way. And especially those who deal with your whole elderly division and so forth and your adult protective services, they're very, 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 very dedicated. When I visited the homes for the aged, the care is exceptional. You can see that the nurses, that the entire staff, that the heart is really in it. When I've gone to the senior centers, even for the Christmas parties that AARP put on there for
Yes,
the seniors
yes.
in St. Croix and St. Thomas, and you can see the love, the real outpouring of love. And especially I have to give a big shout out to Alvin Milligan here on St. Croix. I mean, he just lives that, right? I mean, he puts his entire being into the senior center, and so many other wonderful people. I don't just want to mention Mr. Milligan, but all the others, right, who do such great work. So AARP thanks you and your team for all that you do to help the seniors here in so many wonderful ways. But tell us a little bit more about your response to COVID, and because we hear about this locally all over the nation, the challenges of nursing homes, homes for the aged. So how have you all been dealing with that here in the Virgin Islands?
So in March, when we actually, started to kind of hit here, as far as just in general, and that we had our first, executive order, and safer at home, and started that process. For us at Human Services, we basically shut down everything related to senior citizen affairs. We closed our senior centers. We also closed all visitation to both homes for the aged, and that included all clergy, your staffing, your family, your friends, everything. And we instituted something that was more virtual, like everybody's doing now, Zoom and Microsoft Teams, everything that we're doing. And we instituted that. We were very, very lucky. We started doing the screenings as well. So, there's a lot of controversy about the temperature screen, but we do the temperature screening, but we also do the self-assessment. Have you been around somebody that's been COVID positive or had a PUI? Are you exhibiting any symptoms? And that went for staff as well as residents. So, your residents are the ones that are staying put. Everybody else is coming in and out. And I can't tell you, Troy, that you must come to work and then go home straight, because you're going to have to go to your grocery store. You're going to have to go to your post box. You're going to have to do something. So you're going to be exposed, but you still have to come to work. So how do we do that safely? And we've done, I would say, above average job for the most part of keeping everyone safe and sound and healthy. We've also done an extreme job with our eligibility programs. We've instituted applications online. We've done drop boxes, so there's no standing in line. We've got our federal government to waive and has some flexibilities, so we didn't have to do the in-person interviews. So we've done a lot of things with our federal government, with our federal funds and waiving and our CARES Act money in order to ensure that. We've cleaned, provided PPEs, and doing all of those things that were recommended not only by the Department of Health, which is our Incident Command Commissioner, Tita Encarnacion, and as well as our partners with FEMA and FEMA and National Guard and everybody that's in that, and the CDC, and making sure those guidelines have changed. So sometimes they're recommending one thing and then 3 weeks later it's something different. So making sure that we're up on the best practices, which was really important for us.
Yeah, that's wonderful, and thank you for taking all of those precautions. And you and Tita Encarnacion, Commissioner of Health, you all make a great dynamic duo. From the beginning of this pandemic, I've been communicating with both of you, and we were I was in a press conference with both of you, and then another press conference with the governor and Tita, and I can just feel from both of you that even though we're in unprecedented times, that the both of you have a handle on it, right? And you're paying attention to the CDC, and both of you have great concern for the people of the Virgin Islands. And so I thank both of you so much for being with us and being that guiding light in the midst of dealing with this whole pandemic. And that must be very difficult for both of you each night as you go home and try to unwind.
There's a lot. There was a day or a time when Tita and I talked every day, a couple of times a day, and in looking at that, we're still mourning the loss of our residents from Queen Louise and their families, and that was very hurtful. Not only because some of those residents had been with us for some time, and they were like our family too, and so I think that it was the vulnerability that it touched us, and until it's real for you, Troy, you're not going to understand how important it is for you to do social distancing and wear your mask and make sure you're washing your hands. Until it touches you personally, right, you're not necessarily understanding the depth of the disease and how it affects you. And so I think that we need to make sure that we're always doing that. We're not perfect. Human Services is not perfect by any means, and we do get our fair share of complaints. And I look at complaints as constructive criticism of something, the way we can grow, what we did well or what we did not do well. We do get compliments, which is nice, and I always like to pass those on to the staff. But there's always room for improvement. And so for us, is that if we didn't do something great, why didn't we do great? Do we not have the resources? Or my staff is still human, and so they're still dealing with their own stuff at home, and they're doing the best they can too. So a little grace goes a long way. So attitude is everything. So if you come to me with attitude, Troy, I might have an attitude right back. But even though I'm not supposed to, right? I'm supposed to maintain my composure. But if you catch me on a day, I might be nicer or not nicer. But I think all in all, we're doing the best we can through this. And we have to do it together. And that's a responsibility for this administration. And we have a daily call, just so you know, we have a daily call. And we're so appreciative of AARP because I don't think that the community realizes as much as that what y'all done for us too. The last part of the 1,000 bags, we've gotten so much feedback for that. And it's something so simple, but everybody loves a gift, right?
Yes.
Even if it's little, but everything that was in the bag was needed.
Right.
And so, we're truly, truly appreciative of the partnership for AARP, and we couldn't be more pleased, and we can't wait to do more fun stuff with you guys.
I know. I can't wait for this pandemic to pass. Please, God, we'll have a vaccine soon enough, and then we could get back to business as usual and get out there and do much more fun stuff in the community and impactful stuff too. At AARP, we always talk about fun with purpose.
Yes.
We're all about having fun, but there must be a purpose, going along with that, some deeper or greater reason. And so we look forward to that. And now tell us a little bit about how you all at Human Services are helping people to age in place at home. AARP has a big policy about aging in place and helping people to stay in their own home and to age gracefully there, to live their life as they choose. Does Human Services have services that you offer to people to live in their home and age in place?
We actually do. And so I want to make sure that we're clarified, because this is the part where we talked about housing and the shortage of housing and that spectrum of housing. And so where we have independent living, so I can live independently, but I might just need a little bit of help. Can you come and check on me and make sure I'm doing my medication, make sure that I, check my blood pressure. How am I doing? Making sure that I'm progressing nicely. So independent living to assisted living to then maybe you're getting into a point where you actually are needing 24-hour care. So all of that spectrum, I think, is really important. But for Human Services, what we do, we have a homemaker program. We have our senior nutrition or our Meals on Wheels program that we're actually going and seeing our seniors that are eligible for that program and making sure that they're getting meals. Now, they're not meals that your mama makes for you, okay? Nobody can cook like your mama. Nobody can cook like my mama, but nobody can cook like your mama. And we appreciate that, right? We appreciate that, but it is Meals on Wheels, our homemaker services. And we do provide some of that nursing support as well. And so when we're doing that, we're also protecting our seniors through our adult protective services, and that's through fraud and financial fraud as well as other things. And so we're making sure that they stay safe through those programs. I think you're on mute. I can't hear you.
Sorry about that.
It might be just me, but I was making sure.
Technical difficulty, as they would say. And no, I had myself muted. And so AARP recently supported Bill number 33-0367 to create or to establish the Commission on Aging here in the Virgin Islands. Every state and many municipalities across the country has a Commission on Aging. Here in the Virgin Islands, we have it on paper. It exists in the VI code, but is not functioning. And so at the request of AARP, we got Senator Myron Jackson to agree to sponsor a bill to amend the Commission on Aging as it is and to reestablish it under the Office of the Governor. And so tell us a little bit about your thoughts on the Commission on Aging. It's something we're really excited about at AARP, to bring different departments together, and tell us how you view that.
I think it's always important to bring, like I stated earlier, the public-private partnership. It's not just one agency. And so we're together as a community. And the more that we can look at it as community action, I think that's the better way to go. And so I think if we look at it, the spread, and looking at when I say the spread, that the whole gamut of services that are needed, and then who can provide those services, I think that's important. And so for me, I think that's always a good thing.
It is, and I'm glad you brought up that one aspect, the most important aspect of the Commission on Aging, because I did mention the government departments that pertain to aging, but I did not bring up, but now you alluded to it, all of the other community organizations that will be coming together with governmental departments, right? And so it's a wonderful partnership, I think, that we'll be forming across the community, across the territory, between private and public. And I think a lot of good will come of it, and especially as this whole commission actually focuses on all of the challenges of aging within the territory. So I'm really looking forward to us getting that established, and I'll be working with you on that commission too.
Yeah, absolutely. I mean, that's what we're here for. That's really what we're here for.
Excellent. And so just very briefly, as we're about to come to the end, tell us, how can the Virgin Islands people learn more about the Department of Human Services?
Well, we have our website and we have a Facebook. I think the Facebook page is probably up and running a little bit more active now than it was before. dhs.vi.gov is our website. I think I got that right. It might have been dhs.gov.vi. That's probably it. That was it. So I think that keeping in touch with us, if you're not as tech savvy, calling us directly in either island. And most of our seniors know those phone numbers, and so they can kind of keep in track with us. But I want to say specifically, Troy, that thank you to AARP for all of the wonderful partnerships and the love and the caring that you continue to provide for our seniors. That outlet, that informational network, which I think is really important for us. I also want to say, thank you for my senior leadership team. They work really hard, and our administrators and our staff. They love what they do, and I'm so appreciative that they continue to love what they do. And of course, that the Brian Roach administration and providing the opportunity for me to come home and do what I love every day. And so that's really important for us. So continue to keep us in mind in your prayers, for us to have the strength and the courage to continue to love what we do. And so thank you so much for that, Troy.
Sure. Thank you. Thank you, Kimberly. Thank you for being with us on the show today. Have a great day.
Thanks. You too.